Welcome back to Fluvoxamine Frontiers, battling COVID-19, where we are uncovering new facets of fluvoxamine's role in the pandemic. I'm your host, Dr. Soma Rohatgi, joined by our guest, Saakshi Sharma. Today, we are exploring how gender influences fluvoxamine's performance in COVID-19 treatment, revealing differences between men and women. Think of fluvoxamine as a recipe for fighting COVID-19. But the ingredients need tweaking to suit different tastes, men and women's unique biology. How does gender shape its effectiveness? Let's find out. Saakshi, let's start with biology. How do men and women respond differently to fluvoxamine in COVID-19 treatment?
Dr. Soma, gender differences are significant. Women generally have higher body fat and lower liver enzyme activity, which slows fluvoxamine's metabolism, leading to higher drug levels. Whereas men, with faster metabolism, clear it quicker. A 2022 Japanese study found women had stronger anti-inflammatory effects from fluvoxamine, possibly due to prolonged sigma-1 receptor activation, but also more side effects like nausea. Men, however, needed slightly higher doses for similar efficacy. Immune responses also vary, as women's stronger immune systems can amplify inflammation, making fluvoxamine's calming effect more pronounced, while men's responses are steadier but less intense.
That's interesting. It's like adjusting the recipe's spices for each palate. What evidence highlights gender specific outcomes with fluvoxamine in COVID-19 treatment?
The evidence is growing. A 2023 Brazilian outpatient study analyzed 300 patients and found women on fluvoxamine had a 20% faster symptom resolution than men, likely due to higher drug levels. However, women reported more dizziness, as noted in a 2022 Australian trial. Men, in a 2023 South African study, showed slightly lower reductions in inflammatory markers, but fewer side effects. These differences suggest women may benefit more from fluvoxamine's immune modulation, while men require dose adjustments to match efficacy, highlighting the need for gender-specific approaches.
It seems that tailoring makes all the difference. Now, how can treatment be tailored to account for these gender differences in fluvoxamine's use?
I would say tailoring is the key. For women, lower doses, around 50 to 75 milligrams daily, as tested in a 2022 Canadian study, can maintain efficacy while reducing side effects like nausea. Men might benefit from 100 to 150 milligrams daily, as trialed in a 2023 Indian study, in order to compensate for faster metabolism. Clinicians should also monitor side effects closely, especially in women, and adjust based on body weight and hormonal factors like menopause, which can alter metabolism. Gender-specific protocols, as proposed in a 2023 European review, ensure fluvoxamine's recipe is just right for each patient's need.
A perfectly seasoned dish for everyone. Fluvoxamine is a recipe fine-tuned for each gender's palate, ensuring the fight against COVID-19 is equally effective for all. By adjusting doses and monitoring responses, it serves up hope tailored to biology. Thank you, Saakshi, for cooking up this insight. Listeners, keep exploring with us on Fluvoxamine Frontiers.